Do you know what compulsive gambling is? Have you ever wondered about its causes and symptoms? If these questions have crossed your mind, you're in the right place. Compulsive gambling, also known as gambling disorder, is a pattern of behavior where an individual has an uncontrollable urge to gamble, even when faced with negative outcomes. Picture this. It's like a magnet pulling you towards the game, despite the realization that it's causing harm. But how does this happen? Compulsive gambling taps into the brain's reward system, the same system that responds to pleasurable activities such as eating or socializing. The thrill of gambling triggers a release of dopamine, a brain chemical that makes us feel good. Over time, the brain starts craving for these feel-good moments, leading to addiction. Yet, it's not just about the thrill of winning. The cycle of betting, losing, and trying to recover losses becomes a dangerous loop that's hard to break free from. It's a complex issue, with biological, genetic, and environmental factors all playing a part. Understanding compulsive gambling is crucial to recognizing and addressing it. Have you ever pondered the factors that lead to compulsive gambling? It's a question worth exploring, as these elements are as varied and complex as the individuals who grapple with this disorder. Firstly, we delve into the realm of biology. Numerous studies suggest that compulsive gambling can be tied to an overactive reward system in the brain. This system, which usually lights up in response to enjoyable activities, may respond too intensely to the thrill of a bet, leading to an irresistible urge to gamble. Moreover, some research indicates that people with lower levels of serotonin, a chemical that helps regulate mood and social behavior, may be more prone to compulsive gambling. Genetics also play a significant role. If a person has a close relative with a gambling disorder, they are at a higher risk of developing the problem. This genetic predisposition can be thought of as a loaded gun, but it's important to remember that the gun doesn't fire itself, which brings us to environmental factors. These are the triggers that can pull the trigger on that loaded genetic gun. Stressful life situations such as job loss or relationship problems can contribute to the onset of compulsive gambling. Additionally, cultural influences and societal attitudes towards gambling can play a part. If gambling is seen as a harmless pastime or a quick way to riches, it can be easier for someone to fall into the trap of compulsive gambling. However, it's crucial to understand that these causes do not apply universally. Each individual's journey into compulsive gambling is unique, influenced by a combination of these factors and possibly others yet to be discovered. There's no one-size-fits-all explanation, but understanding these common causes can help us empathize with those affected and steer our efforts towards effective prevention and treatment strategies. As you can see, the causes of compulsive gambling are varied and complex. But with continued research and understanding, we move closer to helping those affected by this disorder regain control of their lives. What signs should you look for to identify compulsive gambling? Compulsive gambling, also known as gambling disorder, is a condition that can be difficult to spot initially, but it leaves a trail of signs and symptoms that become increasingly evident over time. One of the most telling signs of compulsive gambling is the inability to control the urge to gamble. Despite the mounting negative consequences, a compulsive gambler finds it impossible to stop or even reduce their gambling activities. This lack of control over one's gambling is the cornerstone of this disorder. An equally concerning symptom is the act of chasing losses. Compulsive gamblers often believe that they can win back their lost money by gambling more. They are stuck in a vicious cycle where losses lead to more gambling, which in turn leads to more losses. This cycle can be hard to break without professional help. Financial problems are another significant symptom of compulsive gambling. Gamblers may end up spending more than they can afford, leading to mounting debts and financial distress. They may also resort to borrowing money, selling personal belongings, or even stealing to fund their gambling habit. These financial issues can cause significant strain on personal relationships and can lead to severe consequences if left unaddressed. Another sign that often accompanies compulsive gambling is denial. Many compulsive gamblers fail to accept that they have a problem. They may minimize their gambling activities or outright deny that their gambling is out of control. This denial can make it difficult for them to seek help and can delay treatment. It's important to note that these signs and symptoms can vary greatly from person to person. However, any combination of these symptoms could indicate a potential problem with gambling. Recognizing these signs and understanding the serious nature of compulsive gambling is essential. Identifying these symptoms is the first step towards addressing and treating compulsive gambling. What happens when compulsive gambling goes unchecked? This is a question that we must ask ourselves as we delve into the severe consequences of this disorder. Compulsive gambling, if left unaddressed, can lead to a host of serious issues that extend far beyond the gambler's personal life, impacting their mental health, financial stability, and relationships. Financial ruin is one of the most immediate and devastating consequences of compulsive gambling. Gamblers often find themselves in debt, having exhausted their savings, maxed out credit cards, and even resorted to loans or theft to fuel their addiction. This financial stress can create a vicious cycle where the individual gambles more in a desperate bid to recoup their losses, sinking further into debt. Next, we come to relationship breakdowns. Compulsive gambling can strain and fracture relationships as trust is eroded by dishonesty and deceit. The gambler may lie about their activities, borrow or steal money, and neglect their responsibilities, leading to feelings of betrayal and resentment among their loved ones. This can result in isolation, damaged family dynamics, and even divorce or separation. Lastly, we must not overlook the psychological toll of compulsive gambling. The constant stress, guilt, and anxiety can lead to mental health issues, such as depression and anxiety disorders. Moreover, the gambler may experience self-loathing and desperation, which can, in severe cases, lead to suicidal thoughts or actions. Compulsive gambling can also lead to other addictions, such as substance abuse, as the individual seeks to escape the reality of their situation. This can further exacerbate their mental health issues and complicate the path to recovery. So, as you can see, the consequences of compulsive gambling are far-reaching and severe. They extend beyond the individual, impacting their loved ones and society as a whole. It's a ripple effect that spreads outwards, touching everyone in its path. The impacts of compulsive gambling are severe and far-reaching, affecting not just the gambler, but their loved ones as well. We cannot underestimate the gravity of this issue, and understanding the consequences is the first step towards prevention and intervention. Scene script: how can we prevent compulsive gambling, and what are the treatment options available? Prevention is the first step. Education plays a pivotal role in prevention. By understanding the risks and consequences of compulsive gambling, we're better equipped to make informed decisions. Schools, community centers, and online platforms can host educational programs that highlight the dangers and signs of compulsive gambling. These programs can take the form of workshops, seminars, or even interactive courses, and they can be tailored to suit different age groups and backgrounds. Early intervention is another key aspect of prevention. Recognizing the signs of compulsive gambling in oneself or others can lead to timely intervention. This might involve having a candid conversation with the person at risk, suggesting they seek professional help, or in some cases, intervening directly if the situation is dire. Now, let's shift our focus to treatment options. Therapy is often the first line of treatment. Cognitive behavioral therapy, for instance, can help individuals change their thought patterns and behaviors related to gambling. This method allows them to develop healthier ways to respond to stress or other triggers that might lead them to gamble. Medication can also be an effective treatment option. Certain antidepressants and mood stabilizers can reduce symptoms and cravings. However, medication should always be used under the supervision of a healthcare professional due to potential side effects and interactions. Support groups, both in person and online, provide a space for individuals to share their experiences, learn from others, and receive emotional support. Groups like Gamblers Anonymous follow a 12-step program similar to Alcoholics Anonymous and can be a valuable resource for those battling compulsive gambling. Remember, everyone's journey is unique, and what works for one person might not work for another. It's important to explore different treatment options and find what best suits the individual's needs and circumstances. With knowledge, early intervention, and proper treatment, compulsive gambling can be effectively managed. To recap, we've discussed what compulsive gambling is, its causes, symptoms, and consequences. Compulsive gambling is a disorder characterized by an uncontrollable urge to gamble, even when faced with negative outcomes. It's a complex issue with roots in biological, genetic, and environmental factors. The signs of this disorder can be subtle, but they often include chasing losses, financial difficulties, and in extreme cases, resorting to theft or fraud. These symptoms can be devastating, not just for the individual, but for their loved ones too. But there's hope. Understanding and identifying compulsive gambling is the first step towards addressing it. Treatment options are available, and they can be effective when applied early and consistently. These can range from educational programs to therapy, and even medication in some cases. Prevention is also key. By raising awareness about compulsive gambling and promoting responsible gaming practices, we can help curb the impact of this disorder. Remember, awareness and understanding are our best tools in combating compulsive gambling.